I've got with us Professor Ross Fisher, who's a consultant pediatric surgeon at the Sheffield Children's Hospital. He's also chairman of the Pediatric Trauma Audit and Research Network and is an internationally acclaimed presentation expert.
What's wrong with presentations in terms of the message, the media, and the delivery? People suggest to me that things that are wrong with presentation is that the message is not clear. That the supportive media, whatever that is, but that's usually what people mean by their slides, are full of text, complex data, and images that are either useless or annoying or out of focus and stretched. And that ultimately the problem with the delivery of presentations is that it's stilted, that it's unemotional, it might be hidden behind a lectern, but the presentation delivery is very poor as well. Here's the thing. Why do we present the way that we do? That's the second question. Please write down, why do we present the way that we do? Or why do you see presentations done like that? The answer to that question is difficult to say, but mostly it's because that's the way that we've been taught, and that's actually the way that we experience presentations. Everyone seems to aspire to the level of mediocrity that they see around them, so that we have Microsoft Blue Wave, Times New Roman, center justified bullet points, and we read shit out to people. And people think that that's how you give a good presentation. And yet, if I go back to that first question and said, what is wrong with presentations? What you have said is wrong with presentations is exactly what happens in the vast majority of presentations. So the third question I would like you to write down your answer to is, how do you feel presentations could be improved? Please write these down. It's important that you write them down, and I'll come back to them. And ideally not using your phone because you think differently like that. Using a pen and paper, we think better writing analog. How could presentations be improved? Cheers, I've got a beer to try and help me get through this. I know it's obvious, but the answer to how we could improve presentations is usually the opposite of what people think is wrong with presentations. That we need a clear, identifiable, and simple message. That we need the media to be supportive and to be helpful rather than destructive and distracting. And that we need the presentation, the presenter, to be engaging. Which is nice. What I want you to do now is think about the last presentation you delivered. And look at question 1. Then look at question 3. And then look at question 2. Why do we present the way that we do? It's about conformity. It's about wanting, just because you know no better, to deliver in the way that everybody else seems to do it, even although we don't know that it actually works. And yes, I am challenging you to ask if you know your presentation style actually works. Because whilst people may have said to you, thank you for your wonderful presentation, I very much enjoyed it, you know that they also said that to the person who presented like a complete fool. Here's the thing. What if I told you that the world of medical education is a virtual reality? It's just make-believe. You believe that sitting in a lecture theatre while someone reads out PowerPoint to you is teaching. And you are learning something. And that if you are the lecturer, the presenter, that reading out PowerPoint is teaching. And what I want to challenge you is that that is a virtual reality. That is not the case. The truth of the matter is, lectures and presentations are a complete waste of time. And I want you to be challenged by that. And in being challenged, I'm hoping that as part of the engagement of this presentation, you're thinking and going, that's not true. Okay, here's a test. Simple test. The last presentation you were at, just give me 3 facts. Write them down right now. There's lots of 3s involved here, aren't there? The last presentation you were at, write down 3 new facts that you learned at that presentation. And here's the thing. I suspect the vast majority of you are actually struggling to even remember the last presentation you were at, And I know for a fact that none of you have written down 3 new facts that you've remembered for that presentation. And justify it as you might, for all the reasons about, well, I wasn't concentrating, I've taken notes, yada, yada, yada. The world of medical education is a virtual reality. And as upset as you are, you know that is the case. You did not get your degree sat in a lecture theatre. It came from tutorials, from ward rounds, with your chief, in the theatre, in study rooms, in the library. That is where you got the knowledge, not from lecture theatres. And yes, you may have sat through all those lectures and kept notes, if they were even interpretable. But the world of medical education is a virtual reality. Now, if my supported media was working, at this moment, I would be showing you The Matrix Reign. If you've not seen The Matrix, you have got to watch that film. But in The Matrix, one of the lead characters, Morpheus, speaks to Neo and says, the world is not as you perceive it. What if I told you it was a virtual reality? And that's what I'm telling you now about the world of medical education. And what Morpheus says to Neo is, you have to make a choice right now. Choose the red pill or the blue pill. And I'm offering you a choice. Take the blue pill and go on believing the world is as you think it is. Tomorrow you will read out PowerPoint to people in a business meeting, in some form of education, and you will believe that it's being effective.
Hello?
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 Hello? I think we've established that Hanafi is connected and hopefully is now muted. There we go. So this is a challenge. Going back to that choice, take the blue pill and go on believing the world is as you think it is. Reading out PowerPoint to people is teaching, and you sat there listening is education. Or you can take the red pill. And if you take the red pill, I will show you how deep that rabbit hole goes and change your life forever. The choice is yours. It's 7:15. You can just turn this off. Nobody will know. Or you can stay. And here's the thing. If you are engaged, if I have challenged you, if I've upset you, if you're interested, that is how you give a presentation. You get people involved. They want to know more, or they want to prove that you're wrong, rather than just sat there listening and being immersed in the facts, because that's not how education works. Now, there is a science to this. This is not simply just a fashion statement about people who wear roll neck tops and drink little espresso coffees. The science of education and psychology has been looking into this for years, and they have shown that presentations suck, not because you don't care, but because of science. What I want you to consider is that if I read out to you the following numbers, these are the numbers of pi, and I'm actually looking this up so I know what I'm saying. 3.1415925, 35897, 9323, 846. You've already stopped paying attention, haven't you? The reason you've stopped paying attention is because it means nothing to you. But I delivered that with passion and engagement, and yet you have received none of it. And the point that I'm trying to make is that our understanding of the nature of delivery of information and its retention is entirely flawed. It's a virtual reality. The reason I challenge you to write down the last presentation you were at and the number of facts is that in the average 10-minute presentation, people will deliver approximately 200 facts. 200. How many do you think you can actually remember if your life was to depend upon it? 7, plus or minus 2, if your life was to depend on it. But remember, I challenged you that none of you have retained those 3 facts. 3 is the number of facts that you can retain in your short-term memory just by letting things wash over you. We do not have a USB bolt in the back of our head that allows us to download information in that way. And the reason that presentations fail is because the nature of delivery of information. We don't retain a ton of information. Now, when it comes to supportive media, bullet points, text, complex images, complex graphs, we don't retain that either. The reason we don't retain it is slightly more complex, but it has to do with something called cognitive load. Whereas if you are reading one thing, because you're reading the bullet points, and I'm speaking at the same time, you're processing in two separate parts of your brain. Those amazing colleagues who've come from foreign countries and are speaking English as a second language are using three parts of their brain to interpret this. And that fourth part of your brain, the cognitive part, where you are actually challenged by something I say, is pushed to the side because there's a constant stream of information. And you know the worst type of information to distract you? Text. Bullet points actively inhibit learning. You know, they've actually stopped doing research on this about 15 years ago because the evidence is overwhelming. Now, you may not know the evidence, but that's like saying, I don't know the evidence that proves that gravity works. You are still sat on your chair and not floating off into space. The evidence is overwhelming that the nature of delivery of information in supportive media actively inhibits your learning. Not just puts it down a bit, inhibits it. And please don't be bringing me this, I'm a visual learner, because you know, they disproved that 20 years ago. The third part about delivery of information, the third part about a presentation that is a problem is delivery of information. So now I have my finger up my nose, and yes, I know that you're ENT surgeons and it upsets you hugely, but that actively changes the value of this message. The nature of delivery of a message affects its value. So if I was dressed casually, if I was hidden behind my lectern, if I wasn't staring you in the eye right now, but looking over there at the corner of my table, or if I'm not even on the screen, it affects the nature of retention of the message. All of these three parts affect the value and retention of information, whether that is a presentation like this that's intended to be polemic, a lecture on teaching, or even a business case. Your presentation sucks because of the nature of the message, the supportive media, and the delivery. And all of that is neatly summed up in a concept called Bloom's taxonomy. Now, Bloom and his colleagues investigated what education is. Excuse me, it's not COVID. And what they highlighted is that if I was to ask you to write down what you thought education is, most people would come up with something about the transfer of knowledge. And that is true in itself. That is the foundation of learning. If I know nothing about otolaryngology, you teach me something, then I have moved up in Bloom's taxonomy. Facts, however, are not enough. We need more than that. We need understanding of what those facts mean. Beyond the understanding, we need to build in an analysis of what the understanding means, ultimately an evaluation of what those understandings mean, and that will then allow us to create and do something with that knowledge. That is Bloom's taxonomy. Remember I asked you to write down the three facts? Look at your sheet. If you didn't write it down, ask yourself why you didn't listen to the presenter and did something different. But the evidence is clear that if you can't retain three facts, then your knowledge will be imperfect. And therefore your understanding, analysis, evaluation, and ultimately creation with that knowledge will also be flawed. And that is why education, as we currently understand it, is a virtual reality. Knowledge is transferred. Yes, of course it is. That's what happens. But none of it is retained, bar about 1%. 1%, have a look at what you've written down. 200 facts in 10 minutes. And you've retained how much? The world of medical education is a virtual reality. Reading out PowerPoint is not teaching. Sat there listening to PowerPoint is not learning. And you have to make a choice and make a change. Choice is up to you. There are many reasons why we make most of the choices in life, but you have to make a choice. That's the first half of what I'm going to talk about. Now, as part of interaction, what I want you to do now is to write down one thing that you agree with and one thing you disagree with. Write it down by hand on a piece of paper. And if you have to get up and wander around, that's fine, because what I'm going to do is have a drink and gird myself to do the second half of this talk, again, without supportive media. What one thing do you agree with? And what one thing do you disagree with? Okay. Now you may be wondering why I'm asking you to write things down and challenging you and getting you to think. But part of the point of all of this is that we have to change the way that we understand and engage with education. Now, I've been ranting, talking, thinking, discussing about presentations for over 10 years now. And that started with a blog. My prof, when I was doing my master's, encouraged us to blog about clinical leadership. And if you can find my clinical leadership blog online, you get a prize. But after I started that, I then started blogging about presentation skills. I will share with you how to get to my website just in the end of this. But one of the most important facts in my presentation website is a series of step-by-step guides about how to do a presentation. And if you go to the URL that I would share with you on the chat, it's a complex list of about 22 steps about how to do a presentation. And you can work through that. You can go in the hyperlinks and I will explain different tasks, different text contexts and words that are maybe unusual to you, like audience needs and so on. But there at the end, you will then be able to do a presentation if you follow the stepwise approach. Now, if I was showing you the supportive media on the screen at the moment, would be about a 40-character URL. And amazingly, I don't need that to show you how to get to my website. I told you it's about how to do a presentation. And if you put hashtag HTDAP, hashtag how to do a presentation, HTDAP, into Google, right now, the first hit will take you to my website. And what I've shown you there is how you can do a presentation. It's about taking complex information, stripping it down into a single identifiable and memorable message, and transferring it engagingly to the audience. Hashtag HTDAP. And what I'm going to share with you is some steps towards improving your presentation. Remember, I asked you what was wrong with your presentation? The first questions, go back and look at that. And then the third set of questions I asked you was, what do you want to see improving in presentations? And that's what I'm going to do. Now, I've come up with a concept about presentations that I find useful for the nature of construction, delivery, and assessment of presentations. You guys are clever people. I know that because you're fellows of the Royal College of Surgeons of all the different countries in the world. Here it is. A presentation is made up of three parts: a presentation, and a presentation. The first part of a presentation is the message, whatever it is I want to give to you. The second part is the supportive media, whatever is behind me or not, as the case might be. And the third part is the delivery of that. And the value of any presentation, whether it's a keynote speech, a grand rounds where the presenter's supportive media failed, or you presenting at teaching next week, is the product of those three parts: the message, the media, and the delivery. And how we should improve our presentations is by paying attention to those three parts and viewing them through that lens of Bloom's taxonomy. It's important that we understand a presentation, the message, is not simply a download of information, but it's a distillation of that information into a message that the audience can retain. So when I ask you, what was that presentation about? You've got something upon which to hook your information and start to reconstruct the message. And ideally, a presentation should have 3 steps within it. Usually, I look at the 3 obstacles. I suggest to people that presentations don't work. I show them the science behind why presentations don't work. And then the third part is how to use the science to improve presentations. So that if you only retain 3 facts, those 3 facts that you have retained will be the basic structure of my presentation and overall message, that we have to change the way we deliver presentations. And the challenging thing is, the last presentation you delivered, I suspect, was just a ton of data, data upon data upon data. And what I would suggest is that our message needs to change from the old way of delivering a ton of what to delivering the so what. Using Bloom's taxonomy to find out what our message means for our audience as individuals, as different people from the last time we delivered this presentation, and what should they do with that message. So we need to change the message from the what of data to the so what for our audience. How we do that comes down to us as educators, using Bloom's taxonomy. If I tell you that the saddest grave in the world is that of Ignaz Semmelweis, an obstetrician who at the turn of the last century discovered the reason that women were dying in his obstetric unit was down to something that later became known as infection. Semmelweis died 15 years after he discovered this, insane and of sepsis, because all he had was data, and he could not persuade people to move beyond the knowledge to understanding, analysis, evaluation, and creation, that they would do something different with that knowledge he had shared with them. And the reason his grave is so sad is because millions of people died because he failed to persuade his audience of the importance of his facts. A presentation is not simply about delivery of information. It's about persuasion, about moving the audience through knowledge, understanding, evaluation, and ultimately to creation, doing something differently with that knowledge you have shared with them. We have to change the way we deliver our supportive media. Bullet points and text actively inhibit learning. Here's an amazing thing. I'm hoping you've paid attention to me and there are no bullet points behind me, that I have shared information with you that you have retained without reading it off of something. And yes, it might be my script, and yes, it might be my download, but amazingly, I'm doing this without either of them. And the only download you need comes from hashtag HTDAP, how to do a presentation. So what we have to do is stop annotating our messages and illustrate them. Add meaning to what I have got to say by something that supports me. Now, that might be script. It probably shouldn't be. It might be an image. It might be a patient. It might be an old instrument. It might be a video. We need to recognize that the spoken voice is what people are after in a presentation, not documentation. That is what is in a document, .docx. It's not in a .pptx or .kay. Our supportive media should support what we've got to say, so that even if the screen goes blank, I can amazingly still keep talking and you are still vaguely interested. And lastly, we have to change our method of delivery so that our audience are engaged. Now, what does engagement mean? It means some of you are angry with me. Some of you are disagreeing with me. Some of you are passionate and want to hear more. But most of you are actually listening to me. that is what an engaging presentation does. Now, how I do that is through the use of passion, through the change of my voice from something very, very soft to telling you that you're an idiot for wanting to put text on the screen. Emotion, engagement, getting you to write things down so that you are actively involved in what I've got to say, rather than just having information wash over your head. We have to change the nature of presentations because they don't work. We have to stop writing stuff down and reading stuff out to people because it doesn't work. We have to start engaging them and persuading them, whether it's about presentations or the latest research that you just conducted. The reason? Because the world of medical education, and let's face it, most education and communication, is a virtual reality. You know that, and I know that, and we have to change. Now, how we change, I've shared some of that with you. The obstacles to that change are significant. But if you discovered that the operation you were doing did not work, would you just carry on doing it? No, of course you wouldn't. You're excellent clinicians. You would see the evidence in front of you that you can't remember the last presentation you were at, and you would seek a new way to do the operation, and you would change. You would probably look for help in doing that, but you would change. And that is my challenge to you. Look at the notes you've got. Look at what is wrong with presentations. Look at why we present the way that we do and how you would like presentations to change. The science is clear. Presentations don't work. The way we deliver them and the way we receive them. Not because you don't care as a presenter or as an audience member, but because of science. So use that science and change. Why should you change? Because presentations save lives. Education, sharing insights. If you can't change my life by your presentation, it's as sad as Ignaz Semmelweis. Make a choice. Blue pill or the red pill. Thank you for paying attention. It's been a privilege. I'm hoping that there are some questions. Over to you.
I think at the moment, everybody's spellbound by your voice, Ross. But personally, I think I would definitely choose the red pill.
Good man.
I had a question about the signs of failure. And I, I wonder if you could enlighten us a bit more on why exactly presentations fail from point of view of the psychology behind things.
Well, so there's a ton of science looking at the reasons that these things fail. There are about 93 psychological principles that the average PowerPoint presentation breaks. And you can go through them, but I usually don't. I simply say to people, think of the last presentation you were at. Why can you not remember what was said? Why can you not retain that information? That's the evidence. The fact that we don't understand the science behind it is actually just because psychological and educational science speaks a slightly different language to us. The evidence of that science is clear. It doesn't work. Now, the fact that we don't want to accept that is a secondary issue. The evidence is clear. That's why I want people to write it down. Look on the paper in front of you. And interestingly, listen to why people try and deny that. That's the other side of it. It's not about the evidence. Gravity works. The fact that you don't understand it doesn't stop you, doesn't allow you to float off into space.
Perfect.
What other questions? Right. Ali Alami. How do you practically oh, no, it's disappeared. Can you read that for me?
Yeah,
Isha?
absolutely. So Ali has asked that how do you practically translate what you mentioned into a presentation of factual knowledge transfer? For example,
Okay, so
managing thyroid disease.
okay, so I have a presentation that's on the end of that presentation over there that I can give at the very end and show you simply, well, how I would do it without the support of imaging, but I can show you how I translated it from the original into the new one. The answer is it is actually very simple. The problem is what we do the majority of the time complicates things. A question that I often ask audiences is, what was the best presentation you've ever seen? And they usually say, oh, it was when the professor turned up. She couldn't get her slides to work and she just talked to us. That actually our supported media distracts us. It puts a structure onto what we want to say that is artificial and doesn't work, and it disengages the audience. So there are easy ways to do that by about telling the audience what's important, supporting that with information behind us, and delivering that with passion. And yes, even if that's about thyroid disease or the latest northern blotting that you've done in your research.
Um, I believe, hopefully, that answers your question, Ali. I know that it's probably not as complete an answer as you'd like, but I think we're a bit constrained by loss of supportive media at the moment.
Yes, we'll go to the website, hashtag HTDAP, and all of the answers to your questions are there along. If you go to the section under more, there are some videos showing how that might be done.
Before I go to the next question, I have another question of my
Of
own.
course.
So, considering and considering that I've taken the red pill and now medical education is a virtual reality, um,
Yeah.
how do you envision the future of medical education,
Okay.
assuming that everybody takes the red pill and that's what you want, and you want everyone to wake up to what reality is?
All right. So various things. The first is to say this is not simply my thinking. This is evidence-based psychological and educational science theory. This is proven over and over again. So it's not just some random Scotsman ranting. How do I want people to change? At first, I just started off ranting about the bullet points, and then I started to wonder why I was ranting, and I've looked into and analyzed some of the science behind where the problems are. It needs to change because we're wasting our time. If you think of the average 20-minute presentation and 100 people in the room for that, of which they have taken away 1%, that is a waste of time. We have this understanding as educators that we have shared information and so therefore our audience has retained it. That's like you ordering something from Amazon, them saying they've sent it, and you sat there on Christmas Day with nothing to give to your partner because it hasn't arrived. They sent it. If you haven't received it, then it isn't there. Now, that's the mismatch. So as educators, we need to change, and as audiences, we need to change. We cannot simply expect to sit in front of a lecturer and be immersed in her wisdom and suddenly retain all that. We have to start actively learning. That's why I was asking you to do questions, to think, to reflect. And as educators, we have to start stopping. We have to stop just delivering information and work on learning. An example is if you are teaching somebody about a new surgical technique and you just list the 20 steps within that, your audience will have learned nothing. They will not be able to look into the patient's mouth and suddenly do that procedure. They may have understanding of that, but you as an educator have to help them through that. And that's why lecturing is not the best way for teaching of most things that we do. There is a value in it, and we have to figure out what that value is as an educator and for our individual audiences. Excuse me. So if I was expecting you to do a presentation tomorrow, I would have delivered a different presentation. What I'm hoping is that you'll be sat there going, this man annoys me. How can I do my presentation tomorrow? And you're going to go to my website and try and figure it out. That's what education is, not simply a transfer of knowledge. What's the next question?
So the next question is from Vivek. He's mentioned that very stimulating presentation, Ross. How do
Thank you,
you
Vivek.
ensure teaching is standardized? For example, as a program lead, how do I ensure that all my faculty educators have delivered the learning outcomes of my curriculum?
Okay, complex question. Let me bounce that back to you. How do you do that at the present time? Because actually, mostly what we consider is what has been broadcast, not what has been received. This idea that simply because people have had an hour of teaching on the Stapedius, they have retained an hour of teaching on the Stapedius. So our receipt of knowledge is multifactorial and very personal. Some of you will think this is a great presentation. I'm hoping some of you don't, but you've been engaged too. So we have different opinions. Education is more than simply me talking to you. It's hopefully you receiving this information and taking that challenge to learn outside of this experience and going to my website, looking up #HTDIP and finding more about what's going on. That's where learning happens. So it's an interesting and challenging thing that Vivek is asking, because it's not about curriculum delivery, it's about curriculum receipt. And curriculum receipt is not the same as people passing an exam. That's where it gets more complex. And I would love to talk about that, but I don't think this is the place for it. We have to change as educators, and we have to change as students. And sadly, as students, most of us are looking for the USB bolt in the back of our head, where we just sit there, somebody plugs it in, we download everything we need to know about otolaryngology, and suddenly we're qualified for the exam. That ain't how it works. We have to change and think differently as educators and as the educated. Next question.
Perfect. So the next question is from Shalini. She's asking, how about the old-fashioned blackboard teaching? Is it more effective in conveying information than PowerPoint presentation?
So was that Shalini, you said?
Shalini, yeah.
Shalini, I think that's a good question, in that possibly yes and possibly no. It depends on the audience. Now, we have to be cognizant as educators that it's not about us, it's about our audience. Remember, I said that teaching styles don't exist and people saying, oh, I just want facts. One of the values of the talk and chalk thing was that people would consider a concept and discuss it, rather than simply putting all the data on the board, and moving away from that data download to a discussion, to an interaction, to a challenging question, to a thinking, to a reflection, is a different way of teaching. And I do think we need to re-engage with that, particularly online, because right now, some of our audience are already looking at the desk around them. They've got their phone out, they're checking their emails, they're getting a drink and talking to their partners, or pushing their cat out of the way, or whatever. There are so many distractions about online teaching that is much, much harder than it is in-person teaching. So I could see John Cheladurai, and I could eyeball him and go, John, I've got a question for you. And poor guy is now terrified. Don't worry, John, I'm not coming to you. But that in-person teaching is different than this disengaged thing. And we have to learn to educate differently. Another question.
We've got another question from Vivek. He's asked, what are your
Vivek?
thoughts? Yeah, he's asked for your
Yep.
thoughts about medical education on the clinical floor in COVID times.
Okay. So I write blog posts. I try and write one or two every 3 or 4 weeks, and there's certainly 7 or 8 on my website about Zoom and the different presentations and the challenges that that brings to us. Clinical education is a challenge, and it's a challenge because we need to reconsider what we're looking for. It's not simply 122 facts that we want people to have, but it's about an understanding in this Bloom's taxonomy, understanding, evaluation, creation, analysis, and moving information around so that we can use our new knowledge to challenge things. COVID times, we are stuck on screens and in our own virtual reality. And I think that it is valuable to engage with people. And that's why I was saying to you that I was asking questions, so that if I was going to Nasser Yaha Alo Zaib, and apologies if I've said your name wrong, we can actually engage, and I could ask Nasser a question and get Nasser to reflect back to me what he thought the biggest problem with presentations are. And so we can do engagement in a different way. It's harder, it's different, but it's not impossible. But it's essential that Radwan Farah knows that Radwan is part of this as much as Sergei, sorry, is in part of this. I'm just looking at names and I apologize if I'm pronouncing them badly. But that people are involved and engaged and not disengaged and sat there just looking around their desk or around their room thinking nobody knows or cares. So Shalini, I'm coming to you next unless you're careful, just because I can see names on my screen. NASA says it's not interactive. Well, NASA, unfortunately, I think you've just proven it is. I've spoken to you and you've spoken to me, but how we do that can be a challenge in large groups and large numbers. One thing that I often do is I get people to email or message a friend of theirs. So if Mohammed Anwar Frogi was to message Rui Paracho one thing that he has learned, and then they were to carry on that discussion later, that's interaction. That's using your brain rather than just having stuff sweep over your head. Another question.
I think we have run out of questions at the moment. It's like
Okay,
everybody is reflecting on what you've said.
so which is good. That allows me the chance to finish and to close the meeting. Will that be all right?
Absolutely.
All right. Having reflected on all of these things, I do think it's essential that after questions in any meeting, whether it's teaching or a scientific meeting, that the chair, as in your gracious chair here, has given me, the speaker, the opportunity to summarize and to close. So that if the professor disagreed with me and shouted at me a lot, I can still say, Professor, thank you for your opinion. I know that you disagree with our new technique, but mine is the floor and I would just like to close. So I'm going to close now and say to you a few things. The first thing is I hope you've been challenged, because that is what a good presentation does. It doesn't necessarily change you to think one way or the other, but for you to think. And if you have thought, if you've been challenged, then I'm comforted that something has been of value. What I've shared with you is that the science shows us that presentations as they are currently delivered fail, not because people don't care, either as presenters or audience, but because of the nature of the delivery of a message, the media, and its ultimate delivery as a presentation. And for that reason, we have to change, because if we don't change, our message will be lost. And I try to close my presentations, because I've done this many times, with a quote from a film that I really rather like. The film is called The Blade Runner. If you haven't seen it, it doesn't matter. But the important thing is that what I want you to understand is that at the end of the film, one of the characters, Batty, who is a robot who has become sentient, tells about stories. And I believe that all of you have stories and things to share that will change the world. This is what Batty says. I've seen things you people wouldn't believe. I've seen attack ships on fire off the shoulder of Orion. Sea beams glitter in the dark by the Tannhauser Gate. All of these moments will be lost in time, like tears in rain. I think you guys have amazing stories to tell, whether it's about your research that you have changed the world, whether it's about new operations where you've shown people a better way to do procedures in ENT, or even if it's about a business case and why our fourth quarter is a problem and we need to change. All of those moments will be lost in time like tears in rain. Not because you didn't care, not because it's not important. But what Batty says next, time to die. The old ways have to change. We know that they don't work. So my challenge to you is that you recognize this. So make a change and go and change your world by your presentations, by your research, by your new operations, and about how we need to do things differently. Because presentations will save the world. And that's your responsibility. So go and change your world. Thank you for this privilege and this opportunity. If you have questions, please get in touch.